Okay, you guys have been waiting for this forever. This is my OBGYN for over a decade. Dr. Danner, tell us a little bit about you.
Yeah, I've been with you, Emily, I think, like you said, over 10 years now, and I've been in Charlotte about 18 years. I graduated from the University of Florida for my residency. I met my wife at the hospital, and I have 4 kids, and so I know a little bit about pregnancy and delivered quite a few babies in my time. But thank you for inviting me to come here with you and answer some very common questions.
Perfect. So I just think it's so important for you to find an OBGYN that you have a relationship with. You know, someone that you've spent a lot of years with, someone that you can ask the hard questions to and communicate and talk. I mean, what do you think?
Yeah, you know, Emily, medicine is changing. You know, now it's about your open discussions, you know, talking to your doctor. You know, don't be afraid to ask the hard questions, you know. I've always, judged my practice as, we're in it together. You know, this is my baby too until I cut that cord. So if you have questions or concerns, if you don't feel like you can ask your doctor, then maybe that's not the person for you. And having that discussion and relationship and feeling comfortable with that provider is so important because it's going to make your pregnancy better. You're going to be happier. You're going to have a better outcome. You know, you're going to enjoy your labor or your cesarean with that much more enthusiasm. So, I encourage you, if you don't have that discussion, if you feel like you can't get it, well, maybe you need to look around a little bit. But I've enjoyed taking care of you, and hopefully we can do this again in the future.
Absolutely. You guys know I want all the babies, and I just had MERS 6 months ago, and I'm ready for more. So when are you going to give me the green light?
Typically I give patients the green light after 6 months, especially if you've had a C-section. You want that scar to get stronger. The longer you wait, the stronger the scar gets. The risk for that scar to rupture or open during a future pregnancy, it's very low. But waiting at least 6 months, maybe ideally a year, is what we typically recommend. The longer you wait, the stronger the scar is and the lower the risk in a future pregnancy. But it may take more than 6 months to conceive, so if you start at that 6-month mark, you should be A-okay for the most part.
Okay, so I got a lot of heat with working out, but you allowed me to do so. Why is that, or what are your kind of thoughts on working out while pregnant?
Yeah, my general guidelines on working out in pregnancy is, I think back to the old guidelines, which sort of made pregnancy into like a sickness. There were a lot of don'ts. Don't do this, don't do that, don't let your heart rate get this high. Now, the way I talk to people about pregnancy workout is to focus on how they feel during your workout. Sort of gauge your workout on a 1 to 10 scale and try to live in that 4 to 8 range. We want you to live there. Now, it may be easier to get to that 4 to 8 because you're working out for 2, but stay in that 4 to 8 range and you're typically good. A lot of how you work out depends on how you work out before and what your workouts before pregnancy are. So talk to your doctor, come up with an individualized plan, and you should be good to go to stay fit and healthy during your 9 months.
So the bigger my stomach got in the 2nd and 3rd trimester, and people were really noticing, wow, she's pregnant and she's still lifting these crazy heavy weights. Was there something I needed to change, or do people need to change in the 2nd and 3rd trimester?
Yeah, the first trimester, we typically say keep doing what you're normally doing. But as your body progresses and that uterus grows, you really have to think about modification in the 2nd, 3rd trimester. So if you're into strength training, decreasing the amount of weight, maybe the amount of reps. If you're into running, decreasing the distance. Modification is the key. Moderate intensity. Can you talk through your workouts? Can you have a conversation? That's kind of where you want to live in the 2nd and 3rd trimester. Don't try to push for that little extra get. Try to stay in that moderate range and you should be good to go.
Okay, I got lots of questions on my 2nd C-section, and should I have had a VBAC? When are you a good candidate for that?
Yeah, so in the past, VBAC was a little bit discouraged. VBAC meaning vaginal birth after cesarean section. And for obstetricians, we think about it as a trial of labor. And in the past, maybe it was discouraged due to medical, legal reasons or even patient convenience. Come on in, have a baby, go home. But now we know that rate of uterine rupture or problem after a first C-section is very low, probably less than 1%. So if you're a good candidate, and that's determined by you and your doctor. For example, was your baby breached the first time? Did you have a C-section for non-reassuring fetal heart tones? Then you could be a good candidate, and at least a trial labor is something you should consider. But each case needs to be individualized to the patient. So have a good discussion, ask the questions. Don't just let somebody tell you this is what you need to have. Say why, ask.
Okay, so a lot of my friends and people that I know get round ligament pain, and I just want to know more about it, and I think everybody else does. So what are the details of round ligament?
Yeah, obstetricians like to throw around the term round ligament pain. It really is a diagnosis of exclusion, but it's a very common pain we see in the second, maybe even the early third trimesters. The round ligament is one of the support ligaments of the uterus that goes from the front of the uterus all the way down to the groin. So the pain can be in your lower abdomen or groin region. It's typically described as sharp. Sharp pain, maybe jabbing or spasm type pain is typical for round ligament. It typically will resolve just by changing your position. In rare cases, you might need a little regular strength Tylenol, but usually position change does the trick. It's very self-limited. It's nothing to be overly concerned about. It's just as that uterus grows, the nerve fibers or the spasm, the ligament will spasm, and that can create that sharp type pain. So nothing to be too concerned about it. You may notice it during your workouts when you change positions, but just realize that this is self-limited. If it's something that persists, make sure to see your doctor because we need to look for other causes of abdominal pain in pregnancy, but not to be worried about.
So living in the health and fitness world, protein shakes, supplements, those are huge. So I get lots of questions about those. As a doctor, what is your stance?
You know, typically in pregnancy, you want to get on average about 70 to 100 grams of protein a day in a singleton pregnancy. That usually makes up about 20 to 25% of your caloric intake. What I typically say is it's A-okay to do 1 to 2 servings of a quality whey protein during your pregnancy, provided that this isn't the only source of your protein. The main thing I'm concerned about with protein shakes are the other ingredients in the shakes. Is there caffeine? Is there artificial sweeteners like saccharin? Is there too much vitamin A? So what I tell my patients is please just take a picture of the label and bring it to me and let me take a look at it. But usually 1 to 2 servings of a high quality whey protein is perfectly fine in pregnancy. So don't need to stop it, guys.
So a question that we get a lot is pelvic floor issues. And I had someone reach out and they said, why doesn't a doctor prescribe a PT for pelvic floor issues?
Yeah, you know, it's just something we haven't commonly done over the years, and I think it's because most of us doctors weren't really educated a lot about the benefits of PT after a delivery. But we've now learned that pelvic floor dysfunction can be common whether you've had a vaginal birth or cesarean section. So I typically recommend we get you in with a PT within 6 weeks after delivery to work on strengthening your core. Remember, your core is intimately associated with your pelvic floor. We have to give you exercises that also help against urinary incontinence. Also, scar reduction techniques can be used. So PT is definitely a valuable asset in postpartum period, but it's something typically you have to mention to your doctor because we're not good about just doing that automatically. But definitely recommend it, and I think it's a great idea.
Okay, as an athlete, I get a lot of questions about diastasis recti. I probably messed that up, but anyways, it's a big word that we are all constantly hearing. So somebody said that a doctor could maybe even help pull the abs in after a C-section. Is that true?
Well, you know, what happens is as you grow and your uterus grows, obviously, you can have some separation of those abdominal muscles. So it's very common in pregnancy, especially with multiples, for the rectus muscles to start to open a little bit. And you get that little bulge in between that people notice afterwards. That drives a lot of athletes and just general people really crazy, not non-athletes crazy. And, you know, one thing that we do during C-sections, and it's not done routinely, and it's something you may want to ask your doctor if you are planning to have a C-section, or talk about it before, just because you never know if you are going to have a C-section, is the opportunity to sort of plicate or sew those muscle layers together at the time of a cesarean section. I typically routinely will do it in my athletic patients with good core strength, as long as everything, you know, looks like it'll come together nicely. There's always some risk as far as bleeding, you know, hematoma, etc. So we have to be careful in our selection, but it's perfectly fine to talk to your doctor about plicating those muscles together at the time of a C-section. But afterwards, it has to be looked at. This is where pelvic floor, not only pelvic floor, just physical therapy in general can really help to strengthen your core back. And pregnancy definitely weakens that core, which can lead to diastasis.
Okay, after having 2 C-sections, the pooch is there. So why is that so common to have that little pooch?
You know, that pooch is something you'll see after a vaginal birth or after a cesarean section. You know, it's a multifactorial thing. It's a combination of things. Probably the weight gain that's been associated with pregnancy, the extra skin that is stretched, as well as that, what we talked about earlier, that separation of the rectus muscles, what we call diastasis. And those 3 things can contribute to it. Remember, in pregnancy, your core strength really takes a hit. And when you lose that core, these things are just, they're waiting to come in and set that little pooch up for success. But we need to do better at helping it to go down. So you have to keep your weight gain to the recommended levels. You want to keep that core strength as much as you can in pregnancy, not necessarily laying flat on your back. We don't like that for long periods of time during pregnancy, but you can work your abs out in other ways, standing up, against a wall, some planks. So just keep that core strength good. You know, the plastic surgeons make a living trying to help this little pooch, but let's see if we can get them to work a lot less.